My name is Dr. Rabi Ilemona Ekore from Dhaman Primary Healthcare Centre, Kuwait. The title of my presentation is Cosmetic Camouflage Therapy, a vital missing piece in the care of persons with visibly disfiguring dermatological issues in family medicine clinics. The running title is supposed to be a question. Okay, so please, can you see my slides?
Yes.
Okay. So, what is this? Okay. So, I'm making this presentation on behalf of myself and my co-author, Professor Kevin Lee of the University of Cincinnati. So, I'd like to start my presentation by saying that overtly visible skin issues from diseases or inflammatory conditions like acne vulgaris, atopic dermatitis, psoriasis, vitiligo, melasma, vascular anomalies, and also issues from skin trauma or injury from burns, and then post-op or post-dermatological procedures are among the most prevalent skin conditions seen by family medicine physicians and also by dermatologists. I put the dermatologists in bracket because this presentation is about family medicine physicians. So worldwide, these mentioned conditions are about the most seen in primary care clinics. And they come with sequelae, which are visibly disfiguring. And so they cause aesthetic problems for those affected. Some of these problems include dyspigmentation, which could be in form of hyperpigmentation or hypopigmentation, or even other colors like could be like for vascular anomalies could be some other colors. It also results the aesthetic problems could also be from scars or keloids. And it's important to note that both the disfiguring skin conditions and their sequelae are mostly seen in people with the higher Fitzpatrick skin phototypes. That's people with darker skin types. Because the diseases or the conditions are seen more in them, and the response are more severe in people with darker skin types. And the sequelae come also with emotional and psychological distress. And most people who are afflicted by these conditions and sequelae find the emotional and psychological distress most troubling. The psychological and social impact from the disease is attributed or attributable to altered self-perception from self-consciousness or embarrassment, and also from cultural stigma and social ostracization. So these are the factors that result in or contribute to the psychosocial impact of the disease. The people affected from studies that have been conducted reported that the site of the lesion, the site of the disfiguring lesion and their severity have a direct correlation. They are correlated with the perceived impact or the magnitude of the impact. So going by these few things I've mentioned, there is obvious need for both medical management of the lesions as well as supportive care in the form of psychosocial care and concealment of the lesions while treatment is commenced or ongoing. So that brings us to the concealment part, which is the main focus of this presentation. The concealment of the disfiguring skin lesions is achieved through camouflage therapy. Ungan describes in her paper in 2005, describes camouflage therapy as the application of creams, liquids, and or powders to conceal color or contour irregularities or abnormalities of the face or body. So what types of camouflage therapy do we have? We have a permanent type, which is also called micropigmentation or dermatography in the medical setting. Usually the permanent type is invasive, and it includes procedures like tattooing. Tattooing is usually done for scars or other obvious lesions or solid lesions. We have permanent eyebrows or eyeliners. I think the eyebrow is, I think, what is popularly called a microblading now. We have the temporary camouflage therapy. Typically, they are non-invasive, and they include, they can be achieved with the use of liquid dyes like potassium permanganate, indigo carmine, and henna paste. They can also be achieved with the use of self-tanning products that contain hydroxyacetone, and also with colored cosmetic products like liquid foundation and eyeliner and the rest specifically formed for concealment. So for this presentation, we are focusing on the colored cosmetic products as a means of temporarily concealing disfiguring skin problems. So what is colored cosmetic therapy? It refers to skin concealment methods using highly pigmented cosmetics, as I've mentioned, like foundation, eyeliner, and lip liner. It's important to note that these concealment cosmetics are highly pigmented. They temporarily normalize appearance of disfigured skin or the disfigured part of the body, and they are used in the healthcare setting. They can be used in the management of disfiguring medical skin conditions and the transient features we see post dermatological procedures. So what is the ideal property? What are the ideal properties or features of camouflage cosmetic? I'm going to present some ideal features using foundation as an example. Foundation for camouflage treatment. First and foremost, the color is very important. The camouflage product, the color of the camouflage product should ideally match the color of the part of the skin or body to which it's going to be applied. Should be homogeneous and not necessarily be obviously different from the other parts of the body. Opacity is another property. It should be opaque in the sense that it should be highly opaque to the extent that it would almost completely conceal the lesion over which it is applied. It should be inert in the sense that it should not cause irritation, comedons, or allergy in the part to which it is applied. And this can be achieved with the use of appropriate ingredients to formulate the product. The camouflage cosmetic should be waterproof and sweat resistant and not smudge easily on coming into contact with water or sweat. It should have a property called long wear and remain on the skin or the part of the body for as long as desired, for as many hours as possible. It should have holding power and not slide down the part of the body to which it is applied. For instance, some people, when they apply eyeliner, for instance, you can see the black eyeliner sliding down to occupy the crease below their eyelids and all that. The foundation too should not slide down away from the face. It should be easily applied and removed, and then should not require very strong makeup removers or contain acetone to remove it. And it also, very importantly, should provide some sunscreen, good, adequate sunscreen, and homogeneous sunscreen. I want to mention at this point that because camouflage cosmetic products are highly pigmented and provide a high level of opacity, these two features, the high pigmentation and the high level of opacity, also contribute to the sun protection factor of the product. And then, last but not the least, it should be cost effective so that the patients can really readily afford it. They can easily buy it, and this goes a long way to ensure adherence and prescription. Like with all cosmetic products, camouflage cosmetics also could have adverse effects, and this is one of the reasons why, as physicians or practitioners, estheticians, or cosmetologists, we should have very sound knowledge of camouflage cosmetic products and their ingredients so that we can safely recommend, or we can know which products to recommend for our patients. It's important to know the adverse effects because the products, they have the potential to induce, aggravate, or prolong acne, eczema, and other skin diseases. And as mentioned, this could be due to some of the ingredients. The ingredients, especially oils, could be, or the active ingredients, could be comedogenic, they could be irritant or allergenic. So we have a duty to know, to be familiar with a lot of these ingredients and the kind of problems they could potentially cause for our patients. And importantly, match these ingredients and their possible problems with the skin type, whether oily, acne-prone, or sensitive skin, or the skin color of our patients. This is to avoid causing further problems for our patients. So why this study? There was a need to look at this study because, as mentioned before, there are major aesthetic and subsequent psychosocial impacts of some diseases that cause obvious disfigurement on the skin. And we are not so certain about the extent of aesthetic focus in family medicine practices when dealing with dermatological conditions. So we aimed to explore the role of cosmetic camouflage therapy in the management of visibly disfiguring dermatological issues and ascertain the extent of practice of camouflage therapy in family medicine settings. So this study is a narrative review, and we conducted literature search of accessible and scientific or medical databases, source for evidence. And then the following are the key findings. First and foremost, there's paucity of evidence of recommendation of cosmetic camouflage therapy by family medicine physicians. We are hoping that, okay, I'll mention this at the end. Another key finding is that integration of cosmetic camouflage therapy into routine dermatological practice at all levels, still not universal. Most of the patients, it's interesting to know that most of the patients are already using makeup to hide their lesions as at the time of presentation. However, the rate of use of camouflage cosmetics among the patient varies by region, and this is influenced by factors like awareness of the availability of the products, existing cultural norms, and most importantly, product availability. So what did we find according to regions? In UK, Europe, and North America, we found that there's an existing formal skin camouflage service in UK. And specifically, we came across an NGO called Changing Faces. They provide cosmetic camouflage services as well as training for the provision of cosmetic camouflage therapy. And if you visit their website, you will see that evidence that they've impacted a lot of their lives. And again, their focus is on the psychosocial impact of these disfiguring diseases. Another important finding in Europe is that about 31% of dermatologists in an Italian survey reported suggesting camouflage products to a majority of their melasma patients. That is, they mentioned, they suggested, not prescribed. And then in another study, more than 50% of dermatologists actually prohibited their patients with acne from using camouflage cosmetics. This might be because of because We know that some of the products or ingredients can aggravate or worsen the acne. Then about 55% of dermatology residents in the program said they have ever recommended cosmetic camouflage therapy to a patient. So that means just about 45% of them have never recommended it to patients. In Asia, we found that there's existing cultural practice of skin concealment, a long existing practice with the use of masks made from clay. And then we also found that formal medical camouflage services are not so common yet. In the Middle East, the evidence we saw asserts that dermatologists recommend camouflage services or products. However, they said whether it's an issue affecting its use, and they said the training centers are said to be now available. However, this study is actually from is reporting for the United Arab Emirates. In Africa, there's rarely formal cosmetic camouflage training or services, and this is quite an irony because most of the dark-skinned people in the world who are affected by these disfiguring skin lesions are actually in Africa. They suffer the disease the most, and the sequelae, most severe form of the sequelae. So if anything, they are the ones that need cosmetic camouflage services the most. A study in Egypt of vitiligo patients showed that about 60% of them are already using some form of concealment to cover their lesions. So what are the benefits of using cosmetic camouflage therapy for the patients? It provides immediate aesthetic improvement and psychological relief, as we said, and then there's also enhanced social functioning. The evidence we saw for some of the psychosocial impact include one of the studies that was done showed that adding cosmetic camouflage therapy to medical therapy and phototherapy resulted in higher quality of life compared with just medical therapy and phototherapy alone. Another study showed that cosmetic camouflage therapy with medical treatment and psychotherapy resulted in better quality of life compared to medical treatment and psychotherapy alone. So we can see that cosmetic camouflage therapy will actually cause better psychological relief and subsequent social interaction. So these are images of before and after application. This first one is an AI generated image. I deliberately put it here to encourage all of us to tap into the strengths of artificial intelligence now. These other two images are actual patients before and after product application, and for both cases, we don't need a p-value to tell us, to prove to us that there's actually significant difference in using cosmetic camouflage therapy for our patients. The obvious is, the difference is very, very obvious. So apart from the aesthetic and psychosocial impact, we have some authors who have some researchers who are encouraging the use of camouflage cosmetic therapy as adjunct or bridge therapy to treatment. When patients come to us in the clinic or aesthetic beauty centers with obvious lesions, we have the tendency to just give them medications to treat or perform procedures for them. Sometimes these procedures will result in bruises, which are obvious, or leave them with scars or redness and all of that, everything. Levy and Emma and Westmore suggested that in between the treatment time and when there's noticeable clinical improvement, we should use cosmetic camouflage therapy for them. Another author, Dreno, suggests that we should use camouflage cosmetics not only for aesthetics, but also as a cosmetic drug delivery system. So we should also look into the drug delivery capabilities, especially for the new novel drugs that are being developed using nanotechnology and the rest. We should incorporate those into camouflage cosmetic therapy for our patients' benefits. So in summary, camouflage cosmetic therapy provides aesthetic and psychosocial benefits. Patients become more beautiful, and then they have improved psychological well-being, improved self-esteem, and improved social functioning. We could use cosmetic camouflage products. We could consider using them to deliver active ingredients or drugs percutaneously or transdermally. And we should consider employing all of us, all those that matter, especially those who are involved in developing guidelines and policies, to consider including cosmetic camouflage therapy in family medicine clinics where dermatological issues are catered for. And this is because using safe and effective cosmetic camouflage product alongside medical treatment and psychological treatment form part of a holistic approach to managing disfiguring dermatological conditions. So we are recommending raising awareness among family medicine physicians, integrating cosmetic camouflage therapy into standard primary dermatologic care to enhance holistic patient-centered primary care. And then I want to end with an advocacy, first of all, by quoting Antonio, who said that cosmetic camouflage therapy is a therapy that has been developed to alleviate the suffering of those who have been disfigured by a congenital or an acquired lesion and who have no other choice than to live with their deformity. So going by that, I would quote Westmore, who said, all physicians and responsible medical personnel who are concerned with their patients' complete healing and mental well-being should use a properly trained medical makeup specialist as an adjunct to their practice. These are my references. Thank you so much.